After over 12 months of debate and multiple changes, the Inflation Reduction Act has passed the Senate and House and was signed into law by the President. Although this act has several focuses regarding healthcare costs and taxation, the most impactful for Medicare beneficiaries is the prescription drug price reform. The IRA legislation aims to make prescription drugs more affordable to the nearly 49 million Medicare Part D beneficiaries in the country. The legislation includes provisions that will cap costs on Part D plans, allow negotiated prices for expensive meds, provide 100% coverage on Part D vaccines, and more. Hi, I am Danielle Roberts, co-founder of Boomer Benefits and author of the best-selling book, 10 Costly Medicare Mistakes You Can't Afford to Make. In this video, I will dive into everything you need to know about the Inflation Reduction Act and its impact on Medicare beneficiaries. Be sure to hit that subscribe button to stay up to date with all Medicare changes in the years to come. Next year, beneficiaries will begin to feel the impact of the approved legislation. First up is the cap on monthly insulin costs for Medicare beneficiaries with diabetes. In 2021, the Senior Savings Program was rolled out and prohibited participating drug plans from charging more than a $35 copay for specific insulins listed on their formularies. However, not all plans were required to comply. With this new Inflation Reduction Act, all Part D and Medicare Advantage plans with drug coverage must cap covered insulin at $35 per month starting in January. This includes self-injected insulin and insulin used with a pump. Our free Medicare Q&A group on Facebook gets hundreds of monthly questions about Medicare coverage for vaccines, and some vaccines covered by Part D were still costly for many beneficiaries. The IRA requires that Part D plans must now cover many of the vaccines that seniors need in full at 100%. Though Medicare Part B covers some vaccinations at 100%, such as pneumonia, flu, COVID-19, and hepatitis B, some other necessary vaccines fall under Part D coverage. One Part D vaccine in particular, the shingles vaccine, has been a costly and unwelcome surprise to beneficiaries, who sometimes paid for the vaccine in full due to their Part D deductible. Under the new legislation, the shingles vaccine must be covered in full by Part D plans without cost sharing of the application of their deductible. It's great news that this vaccine will no longer have surprise out-of-pocket costs for Medicare beneficiaries. Many people have expressed concern about the pharmaceutical companies raising the cost of certain drugs to make up for losses on other drugs. However, the legislation addressed this potential loophole as well. Beginning in 2023, if a drug manufacturer increases its drugs faster than the inflation rate, it will have to pay rebates to avoid penalties. In 2024, Part D's catastrophic coverage stage is getting a makeover. If you are familiar with the structure of Part D plans, you know that there are 4 stages to all Part D plans. The fourth and final stage is the catastrophic coverage stage, which comes after the coverage gap or donut hole. In the catastrophic stage, the beneficiary pays 5% of the cost of their drugs for the remainder of the calendar year. After paying 25% cost sharing in the coverage gap, beneficiaries are often relieved to reach the catastrophic stage and pay only 5%. However, paying even 5% of the cost of medications with no cap can still result in high annual costs for Medicare beneficiaries, especially those people on expensive brand name meds. In 2024, that 5% cost sharing is gone for good. The elimination of this cost sharing means that once you exit the donut hole, you no longer have any out-of-pocket costs to worry about with your Part D plan. The initial coverage stage and the donut hole will remain the same. Nonetheless, this will provide significant relief for Part D enrollees who find it challenging to pay for their necessary medications during the catastrophic coverage stage. You are probably wondering if this will skyrocket your Medicare Part D premiums. Fortunately, in the same cost-cutting vein, Medicare's Part D plans will have a cap on premium increases beginning in 2024. From 2024 to 2029, Medicare Part D premiums cannot increase more than 6% annually. This change allows more control over premiums and protects the Medicare beneficiaries from overinflated premiums from the carriers. The final change that you can expect in 2024 is an expansion of the low-income subsidy program. Many people know this program as Extra Help. Today, eligibility for this program starts when income is at 135% of the federal poverty level, but will change to begin at 150% in 2024. I am particularly happy about this one because we've seen so many people over the years who were very close to qualifying for that extra help, but missed it when their income was just slightly over the limit. Qualifying for the subsidy eliminates the deductible and provides lower copays, making it more affordable for low-income beneficiaries to afford their necessary outpatient medications. One of the most significant developments in the IRA is the $2,000 Part D cost cap. Capping out-of-pocket prescription costs has been a topic of conversation for years. This change will essentially stop the money bleeding when your out-of-pocket costs on covered prescription drugs hit $2,000 starting in 2025. The cap will spread throughout the year and essentially eliminate the donut hole stage once and for all. The change also allows seniors to spread the burden of the cost throughout the calendar year. However, please note that there will be no change or impact on the initial covered stage where you pay reasonable copays for your medications. Beginning in 2026, the federal government will be able to negotiate the cost of certain high-priced, single-sourced, and biological drugs. Under this new negotiation program, the HHS will publish a list of drugs that are eligible for negotiation, and the list will include 50 Part D and 50 Part B drugs with the highest total expenditures in the most recent 12-month period. Negotiated prices must take effect for 10 eligible drugs in 2026 and increase to 20 drugs in 2029. Although beneficiaries won't see the negotiated prices until 2026, the government will be taking a significant step in creating more affordable drug prices for seniors, which should ultimately benefit all Medicare beneficiaries in the long run. Though controversial in many ways, there is no question that the Inflation Reduction Act will provide much needed relief for many seniors regarding the high cost of prescription drugs. Medicare is a behemoth of a program that offers incredible benefits for American seniors. However, it often comes with confusing intricacies that can be difficult to piece together. The Boomer Benefits team is committed to helping you better understand your Medicare benefits and be here for you when the inevitable issues arise on the back end. We are proud to be one of the only companies of our size with unmatched Part D help for our clients. This is just one reason why you will love working with our client service team, so be sure to check out the video next to learn 12 other reasons.